Assalamualaikum and good evening, everyone. It is with great pleasure that I welcome all of you to today's CME organized by CME MedTweetMy Professional, especially on your lovely weekend. We are so glad to see such an overwhelming response and attendance from today's CME. I'm Adila, your moderator for today. It has been a while since the last time we broadcasted our CME on Facebook. However, please note that only those who join Zoom will be eligible for the CPD point. And great news, you will earn 1 CPD point from today's CME, and we will provide the link for the e-certificate and CPD point at the end of our session. So before we begin, I would like to remind, if you have any question, you can write in the Q&A box and we will address your question after our talk. So climbing mountain is an exciting adventure, but it comes with health risks, especially at high altitudes. Conditions like acute mountain sickness, high altitude pulmonary edema, and high altitude cerebral edema can quickly become life-threatening if not recognized and treated in time. This session will help healthcare workers understand the effects of high altitude on the body, how to prevent altitude-related illnesses, and how to manage them effectively. The goal is to ensure climbers can enjoy their journey safely and return home healthy. We are honored to have Datuk Dr. Alzamani Mohammad Idrose, who is a consultant emergency physician from Hospital Kuala Lumpur, Malaysia, and a council member for the College of Emergency Physicians. His area of interest are critical and emergency ultrasound, disaster medicine, high altitude illnesses, and also medical legal cases management. With the epic topic of mountain and sickness, how to climb safer and coming back alive, let's climb the stunning Everest together with Datuk Dr. Alzamani Mohammad Idrose. So please welcome Datuk.
Assalamualaikum, and thank you, Dr. Nur Adila, for the kind introduction. And it gives me great pleasure to see everyone tonight. I thank MedTweetMy for organizing this event. Tonight I shall be talking on mountain and sickness and how to climb safer and coming back alive. I am actually opening 2 MacBook here. One is to share my slides, and I am going to do that now because I have some problem with the other MacBook. So just give me a second, and I hope that it works well. Okay, let me try and check if you can see my slide. All right, can you see my slide?
Yes, Datuk.
Okay, so I think we can start. So, I shall be talking on this subject on the mountain and sickness. The reason why these subjects, because we see a lot of people climbing these days, but along the way, you see some being sick, and they may encounter many challenges that they may not get to full understanding what the mountain holds for someone who goes on an expedition to climb very high altitude. So this presentation today is actually very much trying to take all of you today to climb with me to Mount Everest, from getting there, traveling there, and on the way to the Everest Base Camp and onwards. So I will take you on a journey, and you will actually along the way feel like you're climbing the mountain yourself. And along the way, you will encounter all kinds of sickness that is relevant to mountain climbers. And along the way, we shall treat the sickness together. And the aim of this presentation is for all of you out there to understand high altitude illnesses, the challenges, and also to understand what kind of illnesses you can get, some basic things you could do to prevent them, and some of the basic things you could do to some extent to treat them along the way. So I will actually go on and show you this. So this is the Everest, and it was conquered in 1953 by Sir Edmund Hillary and Tenzing Norgay, the first person officially to have to be in the Guinness World Book of Record as the first two people to have conquered the mountain. And I just want to share you this, that before Edmund Hillary conquered the mountain, about 30 years earlier, in 1924, this guy by the name of George Mallory attempted to climb the mountain through the Tibet side. Actually, you could climb the mountain either from the Nepal, the south side, or the north side from Tibet. He tried from Tibet, and from Tibet, people could actually look through the binoculars that he was about to reach to the top of the mountain, and then suddenly there was a thick cloud, and he was not seen again. People debated of the possibility that he actually got to the summit, but fell on the way down. And if that happened, he would have been the first person to have conquered the mountain. There was no proof, but 75 years later, his body was found by a group of Chinese climbers, and they found no footage or camera with him. And he actually promised, he brought with him the photo of his wife, Ruth, like this, and of the flag, the UK flag, and to leave them on top of the mountain. So the photo of the wife and also the Great Britain flag was not found with him. So, I mean, what just this shows us is that climbing the mountain can result in death like this. Okay. Now, I just share you, this is a Rainbow Valley on Mount Everest. And you could see this colorful, jackets on this valley. Those are actually the remains or the bodies of climbers which were not brought down. And all these, there were about like almost 300 bodies of climbers who died throughout since 1900s. So what this represents is the reality that along the way in conquering a mountain, you may actually encounter death. So these are how people die on Mount Everest. And from the data by the Himalayan database, they found that the avalanche was the main culprit that killed them. There were incidents of fall, second to avalanche, and number three, the most common cause of death was the AMS or acute mountain sickness. In a while, I will actually explain to you what is acute mountain sickness and how you could get it, and how physiologically the body processes that would lead to acute mountain sickness. And there were, of course, other causes of death from illnesses along the way. You can get sick from exhaustion. And it was found that half of those who died on the mountain, not on the way to the top, but on the way down, which means that on the way down, it's very, very dangerous. In fact, the latest data seem to show that more people died on the way down rather than on the way up. Then there were other causes like hypothermia, frostbite, icefall collapse, falling into crevasse, disappeared and no reason was known. They got lost and probably died from hypothermia. And there were other causes, falling rock, ice and whatnot. So I just want to compare the altitudes from where I am, and many of you here, probably there are also some international audience who are watching this presentation right now. Kuala Lumpur is about 60 meters above sea level. And if you come to Kuala Lumpur, you will find a place called Genting Highlands, and that's about 2,000 meters. And if you go to Cameron Highlands, that's also about 2,000 meters. And the highest mountain in Malaysia is Mount Kinabalu, standing at 4,095 meters. And the Everest base camp is higher than Mount Kinabalu, standing at 5,300 meters. And the tallest mountain in the world is Mount Everest, standing at 8,848 meters. So these are the levels that if you go as low as 2,000 meters, you can be at risk to suffer from acute mountain sickness. And when you go for mountaineering, it's a high risk activity. You can fall, you can have snow blind, you can have acute mountain sickness, frostbite, hypothermia, avalanche, and even get caught in storms. So these are the medical challenges going to the mountains. First, you cannot bring an ambulance to the top of the mountain. There are no hospitals there. At the best, there's probably some makeshift clinic, which are also seasonal. It's difficult to bring adequate drugs upwards. No nearby facilities. You probably need a helicopter to go to certain places fast. And going up, even if you have a helicopter, you can't last longer than 15 minutes because when you go up too fast, you're not acclimatized, and after 15 minutes reaching the altitude, you yourself would get acute mountain sickness. In the coldness, the drug vials may even crystallize. There were crevices, slippery path, and even doctors themselves may risk developing high altitude illness. And there were avalanches occurring almost every day at the Everest Base Camp. So one has to prepare to train, prepare medications, equipments, and in fact, even if as expedition doctors, you have to modify your treatment approach to be economical with the medications that you bring. You need to have insurance. You need to have good mountain boots that could withstand, that's really waterproof because water could seep in and cause frostbite. You need to have very good down jacket and windbreaker. You can find this salt that has goose feathers that could keep you warm, and very good sleeping bags that could withstand a temperature of as low as -20 degrees Celsius. That is -20 below the freezing point of 0 degrees Celsius. You need to have very good sunglasses so that you don't get snow blind. And I believe that you need to have some music, like an MP3 player. Okay, now I'm going to take you to the Everest, and we're going to travel from the south route to go to Mount Everest via Nepal. So this was the picture of when I went there. That was many years ago. We traveled using Royal Nepal Airlines. We reached to Kathmandu, and Kathmandu, we stayed there for about 2 nights. And then we took this small plane and traveled to Lukla. And from Lukla, we traveled on foot to the Everest Base Camp, which took us 9 days. So this is Kathmandu, and I will show you what it looks like. Okay, that's me at the airport, and just like I told you just now, we need very good sunglasses, right? And very good boots that's really waterproof. I have some basic medications in my pouch bag and some MP3 players as well. So this is, we stayed here for about 2 nights. And this is, I think many climbers are quite familiar with this street, Tamil Street. And you will find lots of gears that you could also buy from here, climbing gears. And interestingly, there there were many Malaysians there. Not Malaysians, many Malay-speaking Nepalese there. In fact, I found that there was one shop that when I was buying something that he spoke in Malay, and I was told there was even a village that the whole village is all Nepalese in that village spoke Malaysian language because all of them had worked in Malaysia before. So that was very interesting. You feel a bit like at home. And I found that this is a Malaysian-made car, this Perodua Krisa on the street in Kathmandu. So, you really feel like home. So as I told you, from Kathmandu, you slept there about for about 2 nights, and then you took the small plane and traveled to Lukla. And when you reach Lukla, the altitude is already 2,800 meters. So this was the plane, Yeti Airlines, and we got to this airport, and I show you this. This is the landing site of the airport. And if you look at the landing site, it is not flat; it's slanted. And in fact, on this far end here is a gorge. So a pilot had to align the plane to be a bit slanted when it lands. And there had been crashes before at this airport. So it's a beautiful place, and you will find lots of people here, the Sherpas. They stayed on the mountains, and was the climbing season, and they can make a living during the climbing season by helping climbers in a lot of ways. And I think it was because of their assistance that a lot of climbers were able to get to the top of the mountain. They help not only in carrying stuff, but also in opening the route, bringing tents up, oxygen, food, opening setting up the ropes. So these are very, very wonderful people who helped with all the activities of climbing to the top. So let's climb to the top. So from the Lukla airport, we just have a cup of tea, simple breakfast, and then straight away we start to climb up to the base camp. And on the way up, you will find you have this view of people carrying stuff like this with a very strong stick that they're holding. So what this does is that when they were tired, they will put this stick underneath to rest. So that's quite an amazing view, and to see how much they're able to carry the stuff to the base camp. So these were 6 of us. We were the support climbers. Apparently, when we went there, we went after the Malaysian team who wanted to climb the Mount Everest. So we went there as the support team. So I went there as a doctor. There was another doctor who already went there ahead of me. And with me, there were support climbers who were also involved in doing research. So there were 6 of us. And we had to go through all these the valleys in getting to the top. Actually, this is the top. We traveled through the valleys getting to here, and it takes 9 days to get to the Everest Base Camp. But before getting to the Everest Base Camps, we had to stop at multiple places. So I will just show you that this is the case number 1. That along the way, as we were climbing, we got to this height of about 4 to this height. So we got to the place which was 4,000 meters in altitude. That's about the height of the Mount Kinabalu in Malaysia. So we had a very young guy, a 24 years old guy, very fit. He in fact works in the gymnasium at the University of UITM. But I observed that along the way, he ascended very fast, and he was the first to reach every stop that we had. And when we got to the 4,000 meters, he was well initially, but after about 8 hours, he was not feeling well at all. His oxygen saturation at that time was 79%. I was listening to the lungs, it was clear, but he developed all these symptoms. He got very bad headache. He was fatigued. He was weak, could not sleep. He even vomited. And he had abdominal pain and shortness of breath. And all these symptoms are typical of acute mountain sickness. So, in understanding acute mountain sickness, okay, first, this is it can be a mild acute mountain sickness. You can just have headache and that's it. And the treatment for mild acute mountain sickness or AMS is simple Panadol, paracetamol. But sometimes the headache so severe for those who got severe AMS that even the paracetamol doesn't cut it. And I had to use other medications. And in this case, I had with me tramadol, arcoxia, which are different groups of painkiller that I had to add because of the severity of the pain. And as for this patient, the pain, the acute mountain sickness was pretty bad. And one of the signs of that you got a really severe acute mountain sickness is vomiting. And he had vomiting. And for that, I had to start this tablet, acetazolamide. So this is normally called Dimox, the brand name, which is very popular for climbers who climb the mountain. And because it was really, really bad headache as well, I also added dexamethasone, which is a steroid. So he felt much better after that, and he at least could walk. And with that, we sent him down with the Sherpa 1,000 meters, and he had no more symptoms after that. So vomiting is a sign of very severe acute mountain sickness. So you will sometimes find this signboard on the mountain stating that don't vomit on the mountain and die. So what it means is that if you are climbing the mountain and you start to vomit, especially having the headache, you should go down, and that will be safer for you because it is a pretty bad acute mountain sickness that could progress and worsen. So that's a tip for you. All right, so we continued our journey. So from the 4,000 meters, and we went up further and got to another place called Labuchi, which was about 4,000 meters. And over there, actually, I happened to meet a 32 years old Filipino doctor who was and the doctor for his team. And when I met him, he told me he had not been feeling well since reaching a place called Namchi Bazaar, which is about 3,000 meters. I met him there, and he told me that he took acetazolamide and felt better. So I met him again at the Labuchi lodging house which was about 4,000 meters. And in the middle of the night, while I was sleeping, I heard a knock on my door, and it was the Philippine team, and saying that, "Doctor, can you please help our doctor?" So I went and take a look at him. He was really in a very severe headache, and the oxygen saturation that we measured was pretty low, was only 39%, and he didn't have any vomiting like my guy, and he also denied feeling breathless. So he also got acute mountain sickness. And if you notice, these two cases both had headache, and in this case, pretty bad headache. So there's some challenges with this doctor. He already took the acetazolamide, and yet still having very bad headache. And I wanted to give him a painkiller for the headache, but he was allergic to NSAIDs. He was allergic to all kinds of opiates, which means that I can't use my tramadol. And he was also allergic to paracetamol. And I was lucky that I brought with me etoricoxib, the arcoxia. and gave him that. And also I gave him the steroids. And he was much better after that. And the oxygenation also improved to 69%, was at least able to sleep, and observed by another team member, a Filipino staff nurse, and was well the next morning. And the situation was much better, and he had no more symptoms. He rested for another day at the same height, and descended the next day and climbed back up. And we saw him at the base camp 4 days later. So let's understand what is acute mountain sickness. So what causes it? So what causes it is because of the low pressure at high altitude. It is easier for you to breathe down here because the pressure is higher. So when you inhale, the oxygen would readily go inside. But at high altitude, because of the low pressure outside, you take more effort to really inhale, inspire oxygen inside the lung. And with the normal oxygenation or inspiration effort, there would be less oxygen coming to the lung. So that would cause low oxygen in the lungs, low oxygen getting to the blood. So it's a condition called hypoxia. And when you develop hypoxia, so there is our body would respond by hyperventilation from the detection of the chemoreceptors. And when you start to hyperventilate to compensate the low oxygenation, you start to kick out carbon dioxide more. And when you do this, with the low carbon dioxide in the body, your body would be relatively alkalotic. So because carbon dioxide is actually acidic in nature. So when it becomes alkalotic, the chemoreceptor detecting that there is a alkalosis, then it will cause it will send signals to the respiratory center to slow down the hyperventilation. So because of that, you'll ventilate less. And because of that, you are inspiring less oxygen. So it will drive hypoxia much, much more. So all this will result in low oxygen and carbon dioxide retention. So that brings about the symptoms of acute mountain sickness. So this is a very busy slide. So if I could simplify it, you'll take a look at this. So with the low oxygen pressure, you're inspiring much less oxygen, you get hypoxia. So a condition whereby you had low oxygen in the body, in the blood. So with the hypoxia, physiologically, the body response would be a vasodilatation, or the enlargement of all vessels, all blood vessels in the body, except for the pulmonary blood vessels. So when that happens, if you, in the brain, with the brain, the blood vasodilating, the brain vessels becoming bigger, more blood flow inside, that would cause an increased intracranial pressure. The pressure inside the brain would be higher. And not only that, the condition of hypoxia also causes the increased inflammatory biochemicals, the bradykinin, for example, that would cause the vessels to be porous. It would be prone to leakages. So coupled with the increased pressure and the leakiness of the vessels, there would be fluid going out of the vessel. So the brain would be watery. So it may be, before it became that watery, the pressure itself is the increased intracranial pressure is the one leading you to have a headache. And if it's pretty bad, it can be bad. And if it is high enough, it will make you feel nauseous, and then you start to vomit. If that doesn't stop, the hypoxia, the increase of ICP, and the leakiness, it makes the water to go through the vessel and accumulate in the brain. So it will render your brain watery, or a condition called high altitude cerebral edema, a watery brain. On the other hand, the hypoxia causes the pulmonary vessels to vasoconstrict or become smaller. You know, it's just like the water hose pipe that when you hold it or you compress it, the pressure inside will be very, very high. So what happens, there will be a pulmonary hypertension induced by this pulmonary vessel vasoconstriction, and coupled with the leakiness of the vessel, it will make your lungs watery. So basically, you will be drowning with water in the lungs without a drop of water outside. So that's a condition called high altitude pulmonary edema or HAPE. So you see that all this from the simple acute mountain sickness in the worst spectrum, you can get HAPE, you can get haze, and that could kill you. The number 3 most common killer among Everest climbers. And you may also see puffiness of the face. You may see the legs swollen, and all this is because of the leakages of this fluid through the vessels. So that's what's all about, the AMS, the HAPE, the haze. So if you think about it, to simplify it, it's a fluids problem because of the fluids going out in the brain, because of the fluids going out in the lungs. So that would render you having all these problems of HAPE, haze that could kill you. Now, how can we prevent this? Is by through acclimatization process. So the rule of the game is to climb up slowly. So when you climb up slowly, then you're able to acclimatize. And we may wonder what acclimatize is. So I will tell you what it is. So it is actually a kidney event because when you climb slowly, the kidney starts to produce a compensatory metabolic acidosis because it starts to excrete more bicarbonate. So bicarbonate is alkali. So when it secretes more, the body will be rendered to be more acidotic. So when it's acidotic, the respiratory center, the chemoreceptor detects that and sends the signal to the respiratory center, the brain, to tell the lungs to breathe faster and deeper. So it's like having metabolic acidosis. And for doctors, they would understand it when you are having metabolic acidosis, you will have a Kussmaul breathing. You will breathe faster and deeper. And because of that, you will actually inhale more oxygen inside, and that will help to reduce the hypoxia. So this process takes about 24 to 48 hours. So basically, it's about the kidney. And we talked about the MS just now. I mentioned to you about the headache, neuralgia, nausea. Without acclimatization, you could get all these, vomiting, fatigue, lethargy, breathlessness on exertion, some sleep disturbance. There is a questionnaire, a self-administered questionnaire for climbers called Lake-Lewis AMS Symptom Score. So it looks like this, and you could actually tick this questionnaire, and you could actually Google it. And if you have 3 minimum with a headache, then you have AMS. And it will be moderate if the score is between 6 to 9, and severe if the score is between 10 to 12. So there were some updates of this score, of this Lake-Lewis score in 2018, because this score had been very old when it was introduced. But in 2018, if you look at, there's one component of difficulty sleeping, they had removed that. So you could look at all the other scorings, and from this you could self-diagnose. Still, I hasten to warn you. If you look at this score, they mandated the need to have headache in order for you to diagnose someone having AMS. But I had seen people having AMS without having headache, and it's still AMS. So the diagnosis of acute mountain sickness is very much clinical. It may be someone who is really having severe lethargy, unable to sleep, and that also is actually AMS. So this is the rule. If you want to prevent from getting acute mountain sickness, before 3,000, the 3,000 meters is a very critical critical altitude. Beyond 3,000 meters, you should not exceed 300 meters above. If you get 300 meters above the 3,000 meters, you need to spend 2 nights on the same height. So you go 300 meters, 300 meters, 300 meters. You get to 4,000 meters, you should spend 2 nights. In a day, you should not go beyond 300 meters. So if you notice, when we went to Kathmandu, Kathmandu is also about that 2,000 meters already. We slept about 2 nights. And then we went to Lukla. From Lukla, then we climbed up to 3,000 meters. So at 3,000 meters, we slept for 2 nights. And then from there, it should be not more 300 meters on a single day. However, the lodging house, some of the lodging houses up there before you get to the Everest base camp can be more than 300 meters per day. So you may be at risk of developing acute mountain sickness if you exert, if you climb up too fast. Okay, now this is some of the recommendation, because some people do take a prophylaxis to prevent acute mountain sickness. If you do want to take it, the dose is you can take half of the dose of 125 milligram twice a day, and to be started the day before you ascend. And if you do this, you need to continue for at least another 2 days when you get to the altitude. Because why 2 days? This acetazolamide or Dimox, how it works is that it is actually an antihypertension drug. So we take it not because we want to have the effect to lower the blood pressure, but to have the side effect of the drug. And the side effect of the drug is metabolic acidosis, which is actually artificial metabolic acidosis, as opposed to when you climb naturally and acclimatize. When you acclimatize, you would need 2 days when you reach an altitude, for which the kidney started to learn to excrete more bicarbonate to render the body in the state of metabolic acidosis. So this is what it does. So this dose can be double if your weight is more than 100 kilogram, and for pediatric population is about 2.5 milligram per kilogram to be taken twice a day. So okay, this is the symptoms of MS when you treat it. From mild to moderate, you just need to rest at the same altitude. So from here, if a mild headache is just taking paracetamol. For those who climbed Kinabalu before, if you had an experience, you will notice at Laban Rata, which is 3,000 meters, a lot of people had headache, and they attributed that to having climbed for the whole day. But actually, that is actually acute mountain sickness. It is very mild for most of them. So they just need to take paracetamol, and they usually when they took it, the symptom disappeared, and then they went up to the summit the early morning. For the severe ones, so these were what we give for the patient. You need to descend. If you have oxygen, you can take oxygen there. You start to have to take the acetazolamide about 3 times a day, and even if it is severe, you can take dexamethasone as well, the steroids. And if you have hyperbaric chamber, that would help too. So do you have hyperbaric chamber at high altitude? We do. We call it Gamovac. I'll show you in a while. Okay, now I'm not gonna go through this because I've already explained to you, simplified it, what it means just now, the HAPE. So yeah, so you can present with cough, initially dry, but can become wet and productive later. And you can listen to the lungs, it's all crackling when they get HAPE. So they can be sinus as well. So if you get HAPE, you start to have shortness of breath, the lungs is crackling, the definitive treatment is to go down. But you can still buy time, because sometimes you can't go down readily by taking the drug of nifedipine. So it helps to open up the pulmonary vasculature, and you have oxygen and hyperbaric bag. So apart from nifedipine, so this is for prevention. you can use either one of these drugs, nifedipine, tadalafil, or sildenafil for treatment as well, for having HIV. So sildenafil is actually Viagra. So some people, they said that they brought Viagra and they're happy to climb the mountain, but actually it's helping with this in terms of the pulmonary vasculature to prevent it from vasoconstricting so much. So this is the Gamo bag. This is actually a hyperbaric chamber. And how you do it, actually, you open the bag, you basically have a foot pump, and you pump. And as you know, up there, the problem, the enemy is because the low pressure at high altitude. So you artificially create a higher pressure with the foot pump by staying inside this zip bag and breathing 100% oxygen with you. So, okay, now we climb further up and we get to the Everest Base Camp. So I'll show you, this is the Everest Base Camp. And it looks like this on the Nepal side. That is the Khumbu Ice Falls. And you see the colored thing as the tents over there. And this was the Malaysian camp. And you could see the flag there. And that greenhouse is the most important one. And that's the toilet. So actually, under the toilet, there is actually a container. So to keep the Everest clean, it was mandated for everyone to bring everything down, including the excrements. So once it's full, it will be sealed and they will be brought down. So that was it. So I was staying, this was my camp, and the Sherpa really helped in early morning when I woke up. They will bring this warm water for me to brush my teeth, wash my face. Okay, now we were at the base camp, and during this time, the Everest climbers were practicing. So while I was there, I noticed that a 64-year-old gentleman was coming down from the camp because he went to Camp 3. So he was practicing. He descended down during the practice, and I saw in front of my eyes an avalanche that actually was falling just exactly on his path. He was traveling down with another climber, Malaysian climber. So it was pretty scary sight, and he was lucky because he was 10 minutes faster, and the tail of the avalanche just hit the back, his back. He could have been drowned in that avalanche. So when he got down towards the base camp, he took off the sunglass, and we had nasi lemak and all, and he was very happy to be there. But a few hours after that, about 2 to 3 hours after that, he started to complain severe pain in both eyes. And he could not see, he could only visualize light, and the eyes were slightly reddish. So this was the site at the Khumbu Ice Falls, as these climbers passed through this site. Yeah, they had to go through this. It was very dangerous area. So the thing over here, there's snow everywhere, and this snow would reflect the sunlight. And over there, with not much filtration of the UV light, so if you take your sunglasses off, even for a short while, the reflection will burn the conjunctiva. So you will get actually a burn keratoconjunctivitis, and that will actually render you to be in severe pain. So you will have what is called snow blind. You can't really see it. So for 2 to 3 days, you will be blind and in severe pain. So for this gentlemen, I just gave them some lubricants, even some eye ointment, put some eye pads, so something to relieve the itchiness. And I had to give multiple painkillers because it was terribly painful. So the pain subsided, and it was kept for about 48 hours, and he was well after that. So basically, you just need to allow time for the eyes to heal by shielding it from sunlight. So this is the thing. I've actually explained why it happened just now. It burns the conjunctiva from the UV radiation. So yeah, these are the treatments. So see some of the things that can be given. There are some things which can be debatable. Some suggest to give cycloplegics to relieve the pain, but it may cause the pupil to dilate for a few days. And some had, tried out local anesthetics, which helped very much with the pain, but the safety of that had not been verified, like safety studies. Just to caution you with that, it will heal by itself, but just with some control of pain. So okay, now the climbers are ready to climb to get to the top of the Mount Everest, just waiting for the right time. So we had to prepare some medical for some medical eventualities. So we get to anticipate. We had walkie-talkie to communicate with them because anticipating AMS, haze. In fact, we worried some may get acute coronary syndrome, asthmatic attack. There's this thing very nasty called kumbu cough. Over there, because of the dryness of the air that you inhale, it would irritate your airway and make you cough. And it is really, really irritating cough. It's dry. And sometimes you just, in fact, you probably need something to suppress that. At the base camp over there, some doctors brought codeine that would help to suppress the cough. It's very difficult to control. So you need some painkillers, and beware that the climbers may have frostbites as well. So this was Prof. Dr. Anwar Suun, who was also with the team, and together we helped to package some of the medications for the climbers. So yeah, we put and pack for each of the climbers just in case they got problem. So this is how we communicated with them with the walkie-talkie. So this was in 2007. 7 Malaysians left to scale the mountain, and they went up through the Kumbu ice falls like this. And then I had the case number 4. So the same 64 years old gentleman, he had recovered from snowblind. He survived the avalanche, and on his day 2 of the final attempt, he took a bit longer time, about 12 hours to get to Camp 3. And upon arrival, he became semi-syncopal. He almost fainted upon arrival at Camp 3. So there were 2 doctors, British doctors at Camp 3, and immediately diagnosed him as having his high altitude cerebral edema, the watery brain, because he kind of fainted upon arrival at Camp 3. So that's Camp over there, and so over there, that doctor gave him a jab. IM dexamethasone was given acetazolamide tablet and given full blast oxygen and told to descend in 30 minutes or you will die. So the problem over there, it was dark, and it's not like getting into the lift and press ground button. So going down would mean you would be exposed to the risk of the falling into crevasse and even death. So that's not a feasible option. So I was in communicating, and I was told that when he just drank water and some energy drink, he was pretty much well and having no headache whatsoever, having no shortness of breath, and he was having full mental capacity. So because of that, we made a decision that he could actually stay at that altitude. So yeah, that was pretty much all right. So he stayed, and the next morning he woke up and he decided to walk down and not to continue to summit, to attempt to summit Mount Everest. So the message here is that, you have to make the crucial decision whether you can go on and risk or you can go down. The mountain is always there. And the smarter one, the wiser one will make that decision. Sometimes you would even be, you would even burden your team members who will be probably worried about you. So the bravery is in making the decision to go down sometimes, and that's more important. So for that gentleman, actually, I was wondering whether that was a real haze, because he had no headache, no shortness of breath, no nausea, no vomiting, and he was well after resting and taking power bar drink. So it's probably more of because of exhaustion, because of hypoglycemia, lack of sugar, and also from dehydration. So those things can mimic haze. So it's still a clinical decision, not an easy decision. Okay, so we talk about haze. I'm not going to talk about this because I already explained how it happened. So it's the extreme end of the severe acute mountain sickness. So the definitive treatment is still descent. But in that case, patient was given steroid and it was dangerous to go down. So he stayed where he was. All right, so the rest of the team continued to try to scale to the top of the mountain. So they went up. And these were one of the team members' photos as they went up. And on the 21st May, 6 Malaysians summited Mount Everest. So in fact, the first to have reached there was our own team. The most important, all came back safely to the base camp. And during that time, 8 people died from our neighbors. I think there were some South Korean climbers who actually fell, in fact, got the head decapitated. So it was pretty sad for them. So I think that you need to understand the most important summit is not the summit of the mountain. Your base, where the base coming back to the base camp, that is your actual summit, to be able to come back safely. And in fact, for every climber, that should be actually the final destination. So this is the view from the top of Mount Everest from one of the climbers. It's beautiful. So yep. So I was at the base camp, and then as they came back to the base camp, there was a 52 years old gentleman who was a heavy smoker. He was the first to have gotten to the summit among all climbers. He descended back, and the first to arrive among the team members as well. But when he arrived, he complained pain over the tips of the toes. There were numbness, and there was a cold, and the skin was bluish, and so there was also decreased sensation over the toes. So this patient had frostnip. So this is the thing that. So I just soaked the feet in warm water, and make the water whirling by using my hand. I did give some aspirin and a bit of nifedipine. It is not proven, but it's just in my thinking that it helps for blood circulation on that area, and also to open up the peripheral vasculature, because nifedipine is also used for example, Raynaud's phenomenon. So in some painkiller. So he felt better, and the bluish discoloration disappeared. It was all right, but some toenails came off, but no more pain well after 2 weeks. So we just have to understand that this is before it gets frozen, you get frostnip first. But if the temperature being exposed in the a freezing temperature, you can get into frostbite, which can be like the opposite of burn injury. You have a 1st degree, 2nd degree, 3rd degree, 4th degree, just like the burn injury. A 1st degree, maybe just some numbness, some 2nd degree you start to get blister. 3rd degree, it gets to that really a deeper level, and 4th degree up to the bone. So yeah, so this is the thing to treat them. We need to rewarm. For frostbite, if someone who has a frostbite, it is much worse than a frostnip. So for frostbite, you need to rewarm, again, same manner, but you need to rewarm it slowly if you know that it's going to refreeze again, because sometimes you are at the lodging house, you're going to be exposed to the freezing temperature again. And it's not good when you thaw and then freeze again. It would have a worse outcome. So if you do a rewarm and continue it in a warm, it should be splintered, and we only know the actual damage in 1 to 3 months. And there may be a need for wound debridement and grafting as well. So so this is, you got to prevent a frostbite. So this is frostnip. It was frostnip, then only it gets to frostbite. Okay, now I will just share with you of just a short trip. This is from the north route from Everest to Tibet. If you go through the Tibet route, you could actually drive all the way to the base camp. You don't have to walk but you can't drive straight away because the acclimatization problem. So in a day, you would drive about a few hundred meters, and then you would sleep, and then the next day, few hundred meters, and then sleep. So it goes like that until you get to the base camp. So this is what it looks like. You get on the four-wheel drive, and I did see some of the Tibetans, like this kid, when I checked, the oxygen saturation is only 80%, and they've been living like that. So that's me trying to acclimatize, climb high and then steep low. And then we move on and finally get some actually mountain bike there. And then this is how it looks like, the Tibet Everest Base Camp. And you could actually look at the whole mountain, just like Josh Mallory, that, you could, with the binoculars, you could see two dots climbing almost to the top. So this was getting there to the mountain. Okay, now I'll just show you the 6 case of that same gentleman, went back 4 years later to try again for second attempt through this route. And again, when he got to the third camp at 7,200 meters, he complained distortion of vision. And this time it was not painful at all. And he just said it was not normal. So he said, I can't properly see, but it's not painful. And this is how he probably looks at me. And the eye was normal, and I checked the eye, it was pretty much all right. I didn't have endoscopy with me. And I had an ultrasound, and I asked the permission from this gentleman, and there was to look for anything that could indicate bleeding in the eye. So we just advised not to proceed with the climbing, because what could happen is that rupture of the small capillary in the retina. So this is actually a high altitude retinal capillary rupture. So when we went back, I sent him to the eye clinic to be assessed. So this was some of the BJARM screen chart, all these things that have been done. They checked the Amsler recording chart to look for metamorphopsia, distorted shape and size. And indeed, he had that. So this is what he drew of having these distorted images. And they checked the intraocular pressure, fundus camera. But this is what was found. There was retinal hemorrhage. So it was near the optic disc. You can't see very well, but there's some blush there, and it was confirmed there was a high altitude retinal hemorrhage. So this is some of the things that you can get up there, and it could blind you, and depends on where it bleeds. So I'm just going to go quickly because we don't have much time. I'm just going to warn you, there can be some mimickers. What was taught as haze can be hypoglycemia, can even be stroke, and what was taught as HAPE can even be asthma, and what was taught as asthma can be HAPE. There was a patient who had a history of asthma in one expedition, had shortness of breath, was thought to be asthma, and he died the next day. It was actually HAPE. So we just have to be careful with all these possibilities. There was a patient who had acute coronary syndrome, and I had to give him some of the treatment and ask him to use the insurance to be flown back to Kathmandu. And there was a patient who presented with a haze symptom. We sent to Kathmandu, and the CT scan was done, was actually stroke on the mountain. So you see, it's not easy. Up there, there can be mimickers. This is Himalayan Rescue Association Base Camp Clinic. You have to pay at that time $50 per patient. I mean, we also run our clinic at our base camp, but we provided it for free for just to help people out. So these are some of the difficulties up there. You're not taking shower, in makeshift toilets, and you can get AMS yourself. And you'll be really, really homesick for food, especially home food. And you could talk for 4 hours about Malaysian food, but there's no food. All right, so this is just quickly, I just run through some of the researches on high altitude. So these were what I found among 30 support climbers over there at the Everest Base Camp. A lot of them got kumbu cough, runny nose, blocked nose, sore throat, headache, nausea, vomiting. These are all the symptoms. And even epistaxis, muscle pain, even some had depression out there. So we have to understand these are the symptoms that they can get to be treated. And I did use this system of having stickers on some of the medications that I prepared and packed for the climbers, and made some of the list. Uh, and uh, um, and this is some of the research that I made of some of the 15 some of the volunteers whom I look at blood vessels before and after staying at high altitude. So I found that even for those who climb briefly, initially there was a decreased hemoglobin, there was increased white cell, there was increased platelets significantly. It takes like 120 days before you could actually increase your hemoglobin from acclimatization. There was also increase of liver enzymes among the climbers, so meaning that the heart, the liver also affected. It decreased magnesium, calcium, increased phosphate a bit. So you be affected in terms of nutrition and even the protein levels also up there. So this is up there. When I was at the Everest Base Camp, I noticed something. So okay, I'm just going to try and play this video just to show you. I tried singing up there, and I found that when I sang, the oxygen saturation went up. So I'm just going to show you this video. I'm just going to cut short, because
and my oxygen saturation is 63, only 63%. This is my first day in the Chinese base camp. What I'm going to do is that I'm going to sing, and we'll see the oxygen saturation after I sing. This is now the end is near, so I face the final curtain. My friends, I'll say it clear, I'll state my case, of which I'm certain. I'm live a life that's full. I've tried, traveled each and every highway, and I say, not in a shy way. Oh, and real. I took the blows and did it my way.
okay. Okay. Yeah. Just 1 second. Okay. Okay. All right. So what I was trying to show is that I discovered that when you sing, the oxygen saturation went up. And you see, I was really tired towards the end, because when you sing in that condition, you will feel tired when you sing loudly. But here's the thing. I actually did research on that, and I asked the climbers to actually sing loudly and then sing silently in the heart. And interesting finding was that even when they sing silently in the heart, the oxygen saturation increased significantly. And I presented this in a conference, and I won a prize for that. So this was like it triggered a research interest in me. And I went on to study in a hypobaric chamber that simulated altitude of 5,000 meters. And I found similar finding. Science is something that when you put the same thing, you find the same results. So I make them sing Happy Birthday song over and over again. And I found that when they sing Happy Birthday song, even silently, the oxygen saturation increased significantly. In fact, higher when compared to singing loudly. Both more when they don't sing. So it did something to the way you breathe in inhaling the oxygen inside. So, and it was published in this, you could actually Google it, of that in a journal in America, in the US, it's under Scopus, it's actually a Q1 journal. And I didn't even know this journal existed. And it's called The Voice. So it did increase the oxygen saturation. And I used this for a PhD, and I actually completed this as a PhD because it was experimental, not done before. That was the novelty. I found a lot of things when I did this research, because this is a triangle actually summarizes my finding in my PhD project. So what I found when this is not singing, this is just simply by listening to music. When you listen to music, I found that whether it's arousal type of music or relaxing type of music, both music resulted in significantly higher oxygen saturation compared to no music. And I found that with the exposure to music, there was significant reduction of perceived exertion. There was also reduction of heart rate, the oxygen ejection, the ejection fraction of the heart, and also the reduction of the right heart function. And also there was significant decrease, because I did lung ultrasound as well, reduction of B lines. Apparently, when you go up, you start to see the B line shooting. That means there's a leakiness. So just by listening, I found less evidence of leakiness. And there was some correlations that I found with arousal music correlating with the reduced ejection fraction. These are some of the things. Relaxing music has correlation with the increased heart rate and compared to the no music. So these are some of the things. But I'm just coming to the last slide that, you know, we just need to understand the nature of the disease as we go up, the danger, the challenges that, and we have to understand that even doctors too can be victims of high altitude emergency problem. And we need more research on the high altitude. And this was when we finished, completed, and about to go back. And we packed, we sang the Negaraku, and then so this was the last photo before we left the Everest Base Camp. And if you watch closely, we look the same, whether Malaysian or Nepalese. We all got the sunburn and everything. Yeah, so basically we need to acclimatize. And yeah, I've been talking to Dr. Iskandar that we need to climb safely. We need every climber to screen themselves, because we do not know. You may have some rhythm problems, or you may have some blockage problems, heart diseases that you do not know. So with Dr. Iskandar and the IJN, they had come up with this package if you want to screen before climbing up the mountain. Because up there, if you collapse, to see, but there's no ambulance to catch you. And these are some of the packages that they have. You could always contact IJN and ask and choose the packages that you want. At least there's something. So, to climb safer also, I do recommend try to get a good GPS tracker. And there's now, satellite phones that could function as a GPS tracker, as well as you're able to call, you're able to send text even. And the price is much less in recent years. So it needs to be a good one that could withstand cold weather, because in cold weather, if it's not good, the battery just died. You just can't use it. Yeah, so in short, to climb up safer, screen yourself for heart problems. You need to have some basic understanding of high altitude illnesses, have some basic medication on standby, climb up slowly and enjoy the mountain so that you get acclimatized. You need to have good protective clothes, eyewear, thermal gloves, protective shoes, and potential of music use and modulating the way you breathe and reducing hypoxia. I mean, basically just enjoy the mountain, And coming back alive, I think we need to be humble and to understand that the competition is never with the mountain. The competition is with you, yourself, and be willing to come down in making the calculation of the risk that you are facing. Always have a buddy, keep a GPS tracker to be located and always go there with an insurance. So with that, I thank you. I took a little bit more time, but I assure you, anyone listening to this, I think it's an expensive, it is an expensive preparation, it's expensive presentation, I think, because you have basically gone to the Everest and come back here and understanding what goes through along the way and the risk and the problems. And so that I do hope that you get a clarity of the problems and the risks that you have. So I'm sorry it took a bit more time, but I would be happy to take any questions that you have from here. I will just going to stop the presentation right now.
All right. Thank you very much, Dr. Elza, for a very comprehensive lecture. So, hi everyone, my name is Faiz Mashfood. I will host the Q&A session tonight. But beforehand, we would like to take this opportunity again to give our sincere appreciation to all our beloved participants for joining us tonight. Datuk, you truly managed to bring us to the top of the mountain and bring us back alive, I think, for tonight. And what's most important is the video, Datuk. I think it's a very beautiful voice, but we are very upset because you didn't sing a Backstreet Boy or Westlife song up there, but we will request on that later. All right. So we have a number of questions tonight, and then let us start. Okay. Dato', I'm very surprised with the death cause data, a significantly much higher percentage from avalanche as opposed to AMS, and yet much prevention attention on AMS. While maybe avalanche prevention is the different expertise, is there anything medically we can do if it got in?
Okay, avalanche. Thank you for the question. Question is that the surprise that the highest cost of death were avalanche. And in fact, we don't hear so much about it because usually, if you look at the data, most death occurred among the Sherpas. They were the one who climbed multiple times up to prepare, open the route and everything. But along the way, they would be exposed to the avalanche a lot of times. So, and it's unpredictable. And the question was that, is there anything we could do? We can't prevent it because this is nature. We against nature. In fact, the two climbers who were exposed to it, they just, whisper the shahada. If they die, they die. But the other thing is that important to have the GPS tracker, because if you are buried, it's difficult to find where you are. But with the GPS tracker, then people could locate where you are, and the search and rescue mission, a higher chance to locate you.
All right. Okay. Thank you very much, Dato'. And then moving on to the next question. What is the science behind the rule of 3?
Oh, okay. The question is, what is the science, the rule of 3? I just coined it as the rule of 3. But okay, as a basis, it is all about getting to the higher altitude, and the higher you go up, the pressure of the oxygen would be lower. The partial pressure of the oxygen would be lower. So I've explained earlier, higher you go up, the effort to get oxygen inside in inspiration would be much more. So we find the data has shown you could get acute mountain sickness as low as 1,200 meters, but quite rare. But the risk is higher when you go above 2,000 meters. And when you go 3,000 meters, that's actually the baseline of everything, the number 3. And then at this level, at 300 meters, the pressure gets lower much more every 300 meters. It's quite significant. So if you go beyond that, your body could not catch up to acclimatize. So that's why you go 300, the next day 300, the next day 300. Once you exceed the 1,000, 2 nights, it's giving you time for the kidney to start excreting more bicarbonate, so that you would get the effect of the metabolic acidosis, and in that sense being able to modify your breathing pattern, ability to breathe faster, deeper at least, to inspire better and reduce the effect of the rendered by the hypoxia.
All right. Okay, understood, Datuk. So the next question asks about, can we get EMS on mountain below 3,000 meter? I think Datuk had touched on that. Do you want to elaborate any more further, Datuk, on this?
Yes, very rare. Even at 1,500 meters, you are at risk of getting that. But usually it's pretty mild. The difference is that if you notice, if you are at the area whereby there are green leaves, you are basically quite right because there's oxygen around you. But when you go up beyond 3,000 meters, if you have experienced Mount Kinabalu, beyond 3,000, going to the 4,000, you will find that there's no more plants up there. Plants are important because it could produce oxygen from the photosynthesis. That's when you don't have plants, then you don't get oxygen. You get hypoxia.
Okay, all right. Thank you very much, Datuk, for that. Okay, the next question will be, what is the normal saturation at Everest Base Camp?
Okay, question is, what's the normal saturation at Everest Base Camp? Differs individually, differs from how acclimatized you are. My experience, I was about 65%. And even if you go to Laban Rata, which is also 3,000 meters in Mount Kinabalu, you find that around 75%, some people higher. So now the question is, why some people higher, some people less? It depends on, number one, how acclimatized the person is. Number two is also your breathing ability to breathe well inside. And this you get from the training that you have before you climb. Sometimes I thought that if you are a swimmer, that would also help very much with your breathing ability, because you really practice breathing under the water and improving your breathing muscles. So it differs individually, but from experience, I could say for myself, it's about 65%.
Okay, all right. Thank you, Datuk, for that. So moving on to the next question. What is the cause of increased SpO2 while singing?
Okay, that's a good question. What is the cause of increased SpO2 while singing? So when I did the research, I didn't have machines to help me prove and explaining why that happens. But from what I deduce and from the physiology nature of singing, when you sing, even if you sing right now, happy birthday to you, you see, it causes you to inhale deeper. So that helps you to inspire better. And in fact, if you're singing in the head, it makes you change the pattern of the breathing. And recently, I had this machine that could measure the tidal volume, and I tried that out. When attached, singing silently in the brain, you could see the pattern of the tidal volume becoming a very high amplitude when you sing inside the head, inside the heart. Okay, why I was interested in this experiment, because up there, oxygen is very expensive. One small tank is about 1,600, sometimes in US dollars. You can't bring in oxygen up there, you can't bring ambulance up there, but music is free. Singing is something you could modulate. So it is something, that I found has got some effect, at least in the artificial chamber and also at the base camp with the climbers that I tried out in research last time.
Okay, thank you, Dato'. Yeah, this idea of singing, I mean, at the top of the mountain is very interesting. Yeah. Okay, so next question. Some advice given by Sherpas, any medical basis for low protein diet or high carb diet, and at least need to drink 3 liters of water per day at mountains?
Yeah. So some advice, there are lots of advices if you go to the mountains. So a lot of people like to take dalbat, take this carbohydrate-based food. Well, when you go up there, you'll be wasting your muscle. You'll be using your muscle will be wasted along the way. You need more carbohydrate. Basically, it's like nutrient. Carbohydrate helps you to burn the energy very much. Protein helps you to build the muscles along the way. That even before you, when you are preparing to climb, building your muscle, that would be the one source of energy along the way, especially when you are descending, which is actually pretty dangerous situation. So if you build your protein, exercising, basically it's just food, but it helps when up there, when you are in need of the energy which you would require from the nutrition. So during active ones, when you're climbing, carbohydrate is more easily metabolized. But during training, you probably benefit from the proteins.
All right, okay. So the next question would be, okay, can we differentiate hyponatremia and other electrolyte imbalance up there?
It's okay. Up there, you don't have a lab. Up there, yeah. So up there is very much clinical in whatever that you do. You still need to try to. Nutrition is very important, actually. Actually, if you're able to tackle
Datuk, are you there? I think the line seems breaking. Okay, I think Dr. Alzamani line is breaking. Can our Dr. Norman, can we get back Datuk to bring him in again? In a while, we are finishing our Q&A session. But I think it's very interesting to learn from Datuk Alza on regards to the mountain climb Everest and his PhD topic as well, singing and the increment in oxygen as well as mountain climbing. So we try to get back Datuk in and finish up the Q&A session. So kind of reminder to all the participants, the audience, you need to fill in properly your email to ease the CPD point distribution. And then we will provide a link later for you to fill in within 30 minutes after the event. Yeah.
Okay, Faiz, we can just close the session for now. Huh?
Okay, so I think we lost Datuk in the middle of nowhere. So I think that's that for our session tonight. Thank you, and a very big applause to our speakers, Dr. Alza, for a very insightful talk. And any unanswered question, the audience can always get back to us and via our social media, and we will try to reply as soon as possible.
Sorry for that. I was kind of like cut off just now.
Okay.
Yeah.
Okay, it's okay, Dato'. Okay. So, okay, Dato', I think we are ending our session.
Okay.
So, I think, okay, probably one last question, okay? From the audience, Dato', you did share on your PhD research between relaxing song versus arousable song.
Yeah.
What can you explain a little bit more on the arousable songs?
Okay. Basically, I based it on a paper whereby a researcher used a non-identifiable around classical music. One which has in the category of arousal, and the other one from the category of relaxing from research, whereby the relaxing one is more relaxing, slow. The arousal one is a faster beat. And the reason why that was used non-recognizable is just not to be biased in terms of the effect of the music. So actually it opens the door for more research, because it can be like music that you love, you like, versus music that you don't like. But in that research, the two musics which were used seem to have a similar effect as opposed to no music.
Okay, all right. I think with that, thank you very much to Dr. Elza and a very big applause. So kind reminder to all the audience to fill in the the link that we provided in our chat box, and we will provide the CPD points later lah. So with that, thank you very much, and see you guys again in our next session. Good night and have a good weekend. Right?
My pleasure. Thank you. Take care.
Thank you very much.
Thank you, Datuk.
Datuk. Good night.